Again, I want to extend a warm welcome to this final two sessions in this workforce well-being series on strategies for improving employee fulfillment and retention. I'm Gerard Jolly. I'm the Director of Career Advancement Strategies with the National Association of Community Health Centers, or NACC. I'm excited to be introducing this session today and our featured speaker, Nicole Fields, who I'll introduce more fully momentarily. We want to welcome you back. If you were with us for the first part of the series last week, and welcome you if you're joining us for the first time today. For those of you who are unfamiliar with NACC, since 1971, we've had the privilege of supporting health centers to meet their mission at the national level. And we have a vision for all health centers to be employers, providers, and partners of choice. Of course, workforce well-being supports health centers to be employers of choice, which is a foundation for being providers and partners of choice. Well cared for workforce makes for a well cared for patient population and community. We're excited also to partner in bringing you this series with our friends and colleagues at the Association of Clinicians for the Underserved, or ACU. We certainly enjoyed collaborating to bring this session to you, and hope that you'll be able to enjoy it. Yes, Michelle, Mariah, and Sydney, they're joining us on the webinar today. Before we go into the session itself, I want to just cover a few housekeeping matters. These sessions are being recorded and they will be made available in due course. I believe that's going to be on the STAR² Center website at chcworkforce.org. Mariah can correct me if I've got that wrong, but we'll look forward to being able to access the recording soon. If you have any questions along the way, we've set aside some time at the end for Q&A. Feel free to post those in the chat as they come to mind, and we'll highlight some of those questions as we have time at the end, and you'll be able to ask questions of Nicole at that particular time as well. The description for this session notes the unprecedented levels of healthcare career burnout and intense competition for a limited workforce are making it increasingly difficult for health centers to retain and recruit experienced staff. And this two-part webinar series features health centers that have effectively implemented well-being strategies to address the needs of all health center staff with intentional, data-driven investments in their workforce. Last week, we heard from Jaquetta Gatling, workforce coordinator. Today, we'll hear from a CEO. So we'll get to see those approaches from different levels within the organization, different perspectives within the organization. Jaquetta's center also was in a rural area there in North Carolina. Today we'll get to hear from Nicole, who is in, she told me it's urban just about as it gets in Newark, New Jersey. So we'll look forward to hearing those different perspectives on how to care for your workforce well-being as well. So allow me to take a moment to introduce you to Nicole Fields. Nicole is the president and CEO of St. James Health, which is an FQHC that's serving communities across Newark, New Jersey. Since 2014, she's led St. James through its transformation from an emerging organization into a fully designated 330 FQHC with a strong emphasis on building the systems, teams, and organizational norms that are needed to sustain mission-driven care in a high-demand environment. Under her leadership, St. James experienced rapid growth in both services and patient volume, expanding from fewer than 1,000 visits, I believe it was in the first year, to I think it's over 20,000 annual visits now. Nicole will tell you more about that.
35,000 this year.
That's a lot more than 20,000. Well done. And certainly that's required intentional attention to workforce recruitment, onboarding, retention, role clarity across the various clinical, operational, administrative teams within the organization. Our work has included establishing operational policies, procedures, overseeing contracting, credentialing, privileging, reinforcing workplace customs that support accountability, teamwork, and long-term staff engagement in a health center environment. She has a interesting background, Nicole. She brings a strong business and financial foundation to her people-centered leadership approach. She earned a Bachelor of Business Administration and Finance from Seton Hall University, I believe that was, and began a career including roles with the National Basketball Association. Did you tell me that, Nicole? With the NBA. It's a good time to be connected to the NBA with all that's happening with the playoffs right now. And certainly that background informs her practical perspective on aligning workforce strategy with financial stewardship, productivity expectations, and organizational sustainability. She contributes even beyond the health center workforce ecosystem, being a board member at the PCA, and serving on a number of other boards and city committees. We're excited to hear from Nicole today and to have her share insights and share the great work that is happening and that she's leading along with her team there at St. James Health. So without further ado, please join me in giving our attention to Nicole Fields. Nicole?
Good afternoon, everyone. Thank you for the intro. I'm very excited to be here today and talk to you guys a little bit about workforce well-being in health centers and some things that have been working for us here at St. James Health. Obviously, there's a lot of things that don't work for us, and I have some of that in my slideshow as well. And of course, I'll answer questions at the end. I did tell everyone I'm not great at multitasking, so I can't be going back and forth between the chat. So one thing I want to start by highlighting is at health centers, we frequently talk about the number of lives we touch. But when we talk about this, we're usually talking about patients. And someone recently pointed out to me, as an employer, even as a small-time employer, you're touching a lot of lives of your employees. And it's not just the people that work directly for you, but also their families. You're putting food on their table. You're providing health care for them. You are also sending their kids to school and to extracurriculars. And that's really important to keep in mind as an employer. These people rely on you. They look up to you, and they need you in their day-to-day life. They spend a lot of time at your health center, sometimes more time than they spend with their families. And you need to make yourself an employer of choice, somewhere that people want to be, someplace people wake up in the morning and are happy to be going. So why workforce well-being matters? So to be a place where people want to go, you really need to focus on the well-being of your employees. It's important because to have a sustainable workforce means that we can provide operational health excellence. Health centers operate in high demand environments with limited resources. For us, we're in an urban community. We have a lot of competition with hiring. We have New York City nearby, where there are some of the best hospitals in the country. We have other health centers nearby, but we have plenty of patients to serve. So the high demand environment and the limited resources means you really need to operate at a level of excellence that you attract talent. Workforce well-being directly impacts patient access, quality outcomes, and operational stability. And high turnover leads to disruptions in care and increased recruitment costs. We all know how much it costs to recruit a doctor, recruit a nurse practitioner, and also a C-suite if you're looking for a medical director. The costs get exorbitant. So retaining your staff you have is extremely important, and really only hiring where growth is needed. And investing in staff well-being improves retention, morale, and long-term stability. The workforce challenge. So what are our challenges? Health centers compete with hospitals. We compete with private practices and other organizations for talent. There's increasing patient complexities that requires highly skilled and adaptable staff. We ask a lot of our staff as doctors. We have a lot of documentation requirements for our doctors, our nurse practitioners, even our medical assistants, where a lot of times if they went over to a private practice, they can get paid the same amount of money for a quarter of the documentation that we need. Workforce shortages exist across providers, clinical support, and administrative roles. It's not just our providers. It's not just our nurse practitioners or phlebotomists. It's our medical assistants. It's our front desk. It's our accounting staff. And we need to make sure that we are focusing on all levels to make the organization operate at an optimum level. And retention strategies must be intentional and really data-driven. When you're putting together a retention strategy, if you're looking to implement bonuses for staff, you need to make sure it is data-driven, that you're looking at your numbers, you're looking where you have the highest challenges, where you have the highest turnover rates. Is your turnover rate in the first 30 days, the first 60 days, 90, or is it 2 years down the line? And really focus on what you can do in those specific time periods of when your turnover is. So how do we build a sustainable workforce through workforce well-being? So one big thing for us is hiring from the community. So the reason we hire from the community is the approach strengthens trust, it creates community alignment and engagement. So from hiring from the community, our patients know the people we hire. They're happy to see them. They come in. And it also gives your organization some clout in the community. So how to support a workforce? Well, how to support workforce well-being when you're hiring from the community. So when you do this, when you hire from the community, you need to remember that many of those team members are going to face the same barriers as your patients. This is going to include things like childcare and transportation. And our support system must be designed to meet the realities of the workforce. So if we aim to hire as many of our medical assistants and as many of our front desk staff as we can from our community, we need to make sure that our support system is really designed to meet the realities and the problems that they have on a day-to-day. The strongest workforce is built from the community that you serve. Of course, that comes with challenges. So what do we do when we need to support the life of our employees outside of work to strengthen the care inside of the office? We've done a few things like partnering with daycare providers, and we've sponsored some slots for childcare. We found a couple of childcare organizations that have around the year coverage, because we find one of our biggest points is the summer. Our call outs go out in the summer because the kids aren't in school, and camps are not as good at keeping the kids in camp as the schools are keeping them in school. So we see the higher call outs. Camps have more days off and things like that. So by having some slots in these daycare facilities, we're able to assist our patients with that. We have a wonderful relationship with the Boys and Girls Club here in Newark. The Boys and Girls Club picks up from the schools and brings the children over to the Boys and Girls Club after school. And they have activities that are great for the kids. It's a place they want to be because they have STEM classes, they have a pool. It's not just after school sitting in a cafeteria doing homework. It's a place the kids want to go. And we really encourage our staff to take advantage of it. We know the realities of the workforce. We expect our staff, the health centers open from 8 a.m. to 6 p.m., but schools are not open until 6 p.m. So we need to have a plan for what we can do with their families and how we can assist them, because a lot of our families here in St. James don't have two parents. It's a lot of single parents caring for their children. So having those options of childcare slots and a relationship with the Boys and Girls Club is a huge deal for our staff. We proactively communicate school closures and school adjustments. So many of our families send their kids to Newark Public Schools. And I know in a lot of our heads, we think you should really know that your kid's school is closed tomorrow or that next week is off. But there's a lot of things going on in people's lives, and they sometimes miss the calendar. They sometimes miss the school emails. And maybe it's because they're at work and they're focused on their work email. So we make sure that we send the communication knowing that Newark Public Schools is going to be off and reminding them in advance if they need time off to put it in the system, because we can work with PTO that's requested in advance, but the last minute call outs kill us. We encourage our staff to use internal resources such as our food pharmacy and our community health workers. We have an in-house food pharmacy that's staffed by dietitians, and it gives access to healthy food where families go in and they can shop twice a month for food. So we make it a thing that our staff is more than welcome, and nobody should feel ashamed using our food pharmacy. And nobody should feel ashamed using our community health workers. Our community health workers have access to resources when it comes to utility bill payment and rent and finding Section 8 and getting on Section 8. All those type of things our community health workers help our patients with, and they can also assist our staff with. We support navigating benefits. We know how hard it is with insurance and childcare subsidies and what's out there. So we make sure our staff, our HR knows what's going on and is proactively communicating any changes so people know what's coming down the line. We conduct financial literacy workshops about budgeting and home ownership and debt management. This heavily came out of, we saw a huge increase in our staff using the payroll advance system. So in our online payroll system, they can pay $5 to get an advance on the hours they've already worked. And we saw a lot of our staff using this. So we went back and had a conversation, and we spoke to some organizations in the city of Newark that do some financial literacy and budget management courses. And we've asked them to do those courses for our staff. Sometimes we will do them during our in-house meetings. If we have training that all of our providers are in and we don't necessarily need our medical assistant, medical receptionist, we'll do one of these type classes. So it's not an after hours thing that they're trying to schedule in their lives. And we make sure that there's clear growth and opportunity within the organization. Every job post we put online, we put it on through our online system, and it gets pushed out to our staff in an email with a link. And they never have to ask us if they can apply for a job. We have it very specifically laid out for employees. You know, for a management level job, you have to have worked for St. James for 6 months before applying for this. And we have all of that laid out. So there's never a question, and they know when they are able to apply for jobs within the organization, and that there is upward mobility. And we really try to minimize the after hours burden of the administrative work. This is really for your providers. We have built-in chart time, and we really make sure we monitor their schedules. Our providers don't adjust their schedules. They don't put their blocks in, we do. But we make sure that how the scheduling is done, that they are getting their lunch, they are getting out at the end of the day, and they are getting their charting time. And we specifically build our charting time in to be directly after lunch, because if it's right before lunch or there are patients before that charting time, we know the patient's going to run into them. We know our providers do their best to take care of their patients, and we'll always see them and we'll always take the extra time to talk to them, but they do need their charting time. We have high expectations with their quality, and we have high expectations on how fast they close their charts. So we really make sure that that time is built in. If we're going to hold them to those expectations, we need to give them the time and ability to do them. And we talk to our staff. We take the time to understand our challenges. One big thing I really drill into our managers is that when our staff comes to us and they're venting, sometimes it's just that. Sometimes it's a bad day. Sometimes, every single patient showed up plus 6 walk-ins that they didn't want to turn away. And they're going to complain about the schedule. And it's not necessarily that our scheduling needs to be adjusted. It's they needed to vent that day. And we then check in with them 48 hours later. And hopefully it's been an easier day that day and they're happy. But we do find that, they do calm down, and it is a matter of listening to them and taking the time to understand their challenges. We have flexible scheduling. So we don't see flexibility as a perk. It's an essential to sustaining our workforce. Our hours are 8 a.m. to 6 p.m. So that right there means that you have the option of the 10-hour days or the 5-hour days. We know the 10-hour days are not for everyone. If it was up to me, I would love everybody to work those 10-hour days and work the 4-day shift. I'd have my Monday to Thursday, I would have my Tuesday to Friday, and then we would have our Wednesday to Saturday staff. But it's not realistic because not everyone can get in by like 7:45 in the morning to start seeing patients at 8 and leave a little after 6 because they have lives, they have families at home, they have kids that have to be picked up from school. But there are some staff that love that and they love the 3 days off in a row. So we do offer that. And I would say about 60% of our providers take that, maybe a little more, maybe 70%. And then the rest of them take that 5-hour shift, that 5-day shift, sorry, 8 hours a day. So with that, we also do give the option of, do you want to start at 8 or do you want to start at 9? And we try to give that flexibility too, because a lot of times people either have trouble in the morning getting kids and families out the door or in the afternoon and they can work around it. Because we're open 6 days a week, we also can offer the shorter day when absolutely needed, especially if it's somebody that's skilled. So we can have a day that's shorter than 8 hours if they want to work 6 days a week. So we kind of play with that schedule according to the needs of the person. And we really do feel like it is essential because we would not have the workforce we have if we didn't have the options on the hours that people can work. There are just a lot of family responsibilities, and work-life balance is a key driver for your retention. We try to prevent burnout through operations. A lot of us over the past few years saw the burnout happen. I am the founding CEO of St. James. It's 10 years old this year in operating. We were a new start, new access point. So our workforce started as absolutely nothing. We were just a board of directors and myself. We hired a CMO and we've expanded since that. And we've just grown and been able to really retain our providers. Now, those first few years, we didn't see that. We did see big turnover, and we attributed that to a lot of our policies and procedures were still being built. And, it was only a place for people that were really flexible. And not a lot of people like to be flexible and like changes. So we like to say that we really need to have our operations in order to prevent the burnout. So those first few years, we saw the turnover at all levels of our workforce, our providers all the way down. Then we all went through COVID, and it got a little crazy there. And after is when we really saw everybody move. We saw people jumping around. I think a lot of people didn't know where they wanted to go, if they wanted to stay in healthcare, if they wanted to change the type of healthcare they were in. We've seen a lot of people going to remote companies. We all are now competing with companies that are offering people online. They can stay online and just work a couple hours and be paid. But in the last 3 years is where we have really seen the stabilization of our providers. We don't really have any turnover at our provider level anymore. We have our social workers that have been with us a long time. We have our medical receptionists that stay with us and our LPNs. We have one level that we are now concentrating on to really look at our operations and see how that is affecting our turnover, and that is our medical assistants. There's a lot of work on the medical assistants, and they really need to have a good operational workflow to feel comfortable and to do their job on a day-to-day basis. So things that we do, we avoid double booking right before lunch and at the end of the day, because like I said before, everybody wants to be able to get their lunch and everybody wants to get out at the end of the day and clean up their charting. We protect breaks and we have manageable schedules to reduce stress. We have operational discipline that discipline directly impacts the staff. So we make sure that we stay on top of it. Small scheduling decisions have a huge impact on the workforce well-being. So when you do double book that patient at the end of the day, that really does hurt your staff. Your medical assistants are staying, your front desk is staying, and everybody just wants to get out the door. And they don't treat that last patient the same as they have all day because they're concentrating on getting out the door. And this is a huge one. Choosing an EMR system that streamlines charting. We went to Epic 2 years ago, and we've really seen an improvement. We're able to train our providers better. Most of them have worked on Epic somewhere else, so it is a great system. We've built in wonderful smart sets for our UDS that kind of remind them what they need to do for patients to hit our UDS measures. And it really streamlines their process for charting. So they're not taking a ton of their charting at home. We also make sure when somebody takes PTO, they're assigning their labs and their messages to somebody else. We've created teams of either 2 or 3 providers. And when somebody on that team is out, they have to assign their labs and messages to those other providers. And then spending the time on your EMR setup with smart sets, AI, dictation devices. There's a lot out there that at the end of the day, the cost of them is a lot less than what it costs to recruit a new provider. Incentive bonuses and workforce well-being. So we have a great incentive bonus program, and we think this is something that really sets us out with hiring. We really think the 2 things that set us apart from hiring are our flexible scheduling, where you have the option on the 4, 5, or 6-day work week, and our incentive bonuses. So you need to make sure your incentive bonuses align with productivity and quality outcomes as well as patient experience. You're not just incentivizing the productivity, the number of patients, because as health centers, we care about the quality. We care about our outcomes. We care about the care that the patients are giving. So you need to align all 3 of these things. And also the patient experience. We are doing our patient reviews. They're sending in their information, and we want the patients to have a great experience. So we do bring that into our incentive bonuses as well. By having this, it promotes accountability and consistency across all of our providers, and a well-structured program increases engagement and overall performance. Financial recognition reinforces desired behaviors as well as priorities. So what we pick for quality really shows our staff where our priorities are. So we recognize the effort required to meet the increasing clinical needs and documentation. As I said before, we have a lot of documentation needs. All of us are focused on our UDS. We're reporting to our board, our clinical quality committee, and we want to make sure that that clinical documentation is where it needs to be for all of these things. We reward efficiency without compromising quality of care. So we reward you for seeing more patients, but we still need your level of care. We still need your quality of care. We also reward for how fast charts are being closed. But again, you don't want to compromise the charting for how fast the charts are being closed. We encourage ownership of your patient outcomes and performance metrics. It creates a culture of transparency, fairness, motivation. It sets clear, transparent expectations so staff understands how performance is measured. You align the incentives with the organization's priority and your mission, and you ensure goals are realistic without operational constraints. You have to make sure you have the staffing, you have the scheduling, and you have the patient mix for the goals you set. So this is what our quality incentive program looks like. So our first component is our productivity. So it's our 4 days schedule. It's 20 visits per day. So this is not number of patients scheduled, it's number of patients seen. And for the 5-day a week, it's 16 patients per day. And it's a productivity based on the total encounters and the scheduled days. And the quarterly bonuses ranges from 500 to 3,000 based on their performance. So basically, if you hit 90% of your goal, if you're a 4-day provider and you're hitting 90% of the 20 patients per day, oops, sorry, I went outside too far, 20% a day, you then that quarter get a $500 bonus. If you hit 95%, and it goes up from there, it starts at 90% and it goes up to 110%. If you're at 110% of the 20 visits per day, and we do have providers hitting our 110%, they're getting a $3,000 bonus for the quarter. Component number 2, to get this, your provider needs to meet at least a 70% productivity to qualify. So this is because when you have new providers coming on, they might only be at 40 or 50 or 60% of their productivity when you're onboarding them and when they're starting to see patients. So once they hit the 70% of productivity, they qualify for these other components. So on this, the providers must meet the 70% of the goal to the productivity to qualify. There are 2 different quality measures that must meet certain thresholds. So each year at the beginning of the year, we choose which 2 quality measures we're trying to improve, and we set thresholds. So for example, if you're using your weight assessment measures, if the provider is hitting, 85% of their weight assessments, then they get a $500 bonus. If they're hitting 90%, they're getting a $750 bonus. If they're hitting 95%, they're getting at $850, and then I believe the final amount for 100% is a $1,000 bonus for that one. Then there's patient satisfaction. We have a bonus of, I think it's $250 if they're hitting the 85% on the patient satisfaction scores, and it goes up to $500 for the 90% and $750 for the 95%. And then the chart closure, we require them to close their charts within 72 hours, and they get a $500 bonus a quarter for that. So basically, in a quarter, a provider, if they're seeing 110% of the daily goal, they're getting a $3,000 bonus. Plus, if they're hitting their quality measures, they can be getting another $750. Patient satisfaction, say they get 500, and say here they get another 500. So they can get a nice quarterly bonus when it comes to our incentive bonuses. And this is on top of their normal salary, obviously. And it's something that our staff and our providers are very happy about. And we see that they're working towards it. They'll very frequently, especially on the patient satisfaction scores, they will ask us, how did I get an 80% this quarter? And I'll tell them, only 4 of your patients actually filled out the satisfaction score. And remember, if 4 patients fill it out and one of them wasn't the happiest, or one of them you didn't give exactly what they wanted, that really brings down your score. So you need to encourage your happy patients to fill out the patient satisfaction. And when we told them that, we've seen huge jumps in the number of patients that are filling out the patient satisfaction scores. So all around, it helps the health center. It builds what we want to do. We want those patient satisfaction scores. We want the feedback. We want those charts closed to get our billing out, and make sure that it's ready for their referrals and their case management. So it helps us all around, not just on the number of patients we're seeing, but on the quality of care, the patient satisfaction, and getting your billing out the door. Here's some reminders about the incentive bonuses. Incentive bonuses should support, not pressure the workforce by aligning expectations with achievable and meaningful goals. If you set a wild goal, if you set the productivities too high, that they have to double book all the slots in the day, nobody's going to look forward to it. Nobody's going to be excited because they're going to think of it as not achievable. It also, if you have huge no-show rates, you need to take that into account too. And you need to then put in measures to really work on those no-show rates to make it that these staff members are able to hit their goals. ensure inclusivity across the care team, and recognize the contributions of support staff. So we, with our medical assistants and our LPNs, have put in incentive programs as well. The medical assistants are tied to their providers on the quality, and we'll give them a small bonus. We do theirs yearly. We'll give them I think it's a $500 bonus each year if they're hitting certain numbers on their weight assessment or their depression screenings and things like that. And then our LPNs, we've had them focus on some measures like vaccinations and stuff. We balance productivity with quality and patient experience to avoid unintended consequences. I said this before, we all know our quality is of utmost importance, and we don't want to push our staff to see too many patients that our quality drops or our patient experience drops. And then we have to regularly review and adjust the program based on the data and our feedback. So we send out our annual review to the staff for them to fill out. It's a survey that goes out about their employment and what they think of, us as an employer. And when that goes out, we make sure that we're asking questions about the incentive bonus program and get their opinion. And then I told you each year we look at our quality measures and decide which one we want to focus on that year for the bonuses. The next thing we really focus on is our paid time off structure. We make sure our PTO is separate from sick time. You have your sick time bank and you have your PTO bank. All staff receive 40 hours of sick annually separate from their PTO. And we have 5 different tiers of PTO based on role. So our PTO, where each tier starts, is set by role. So for example, our medical assistants, medical receptionists are all in one tier, and it goes up from there to the provider tier. We have anniversary increases. So employees receive additional PTO on their work anniversaries, and that starts after 2 years of employment. And our structured PTO supports our long-term retention on our workforce satisfaction. We have obviously our days off that are set, our holidays off, but we want to make sure that we're giving staff access to be able to take time off, to be able to take vacations, spend time with their family, and we want to reward the time they spend with us. If you're here for 5 years and we've never, we've given you salary increases, but we've never increased your PTO, we just feel that it causes high turnover. And we think it's important that we really make sure and reward people for staying with us. And then at the end of the year, we do allow our employees to choose to carry their PTO or carry over their PTO or have it paid out at the end of the year. Again, I kind of mentioned before, we've really encouraged our staff to take advantage of some of our budgeting type courses, and but we do see that some of our staff still, have financial issues at times, and they meet with our community health worker. So giving them this option at the end of the year to take the payout really does help them sometimes. And some of them do choose that, where others, want to carry their PTO over. And we do allow that as well. And then, of course, all of our sick time always carries over. Leadership and environment. Managers should recognize when staff need to be heard, not fixed. I went into this before. It's really making sure your managers know how to listen to your staff and let them vent and not always react to everything they're saying. They do have bad days. They are busy. They're under a lot of pressure. So make sure that you're able to listen to the staff, and all your managers know how to listen to their staff. Allowing staff to vent can prevent burnout and escalation. So, you need to know when it is something to escalate, when it is something that needs attention, but also when it's just a conversation, when they just need to talk. Follow up after high stress days and reinforce support. So it's not just having the conversation that one day, but like I said, that 48 hours or 72 hours out, making sure that you're going back and checking in. Hopefully, again, it's been an easier day now, and the provider recognizes that they all have bad days and good days, and we will be here and support you. Strong leadership creates trust and stability, and ongoing leadership training is important. When we promote, I said, we promote internally. If it's somebody going into a management type role that they're going to be overseeing anyone, we do require management training. And we make sure that we have ongoing leadership training. So each month, our staff has to do online training, and all levels of staff do one general online training. We've set all our topics for the year, but anyone that's a management level also has a secondary one that gets pushed to them. And it has to do with leadership and management or ethics as managers. And they have to complete both, because the ongoing training for your leadership and reminders how to manage are always important. We all get into very stressful situations, and you don't want to take it out on your staff. You don't want to say something that you can't take back, or get upset with them. So it's important to make sure you're doing the ongoing leadership training. And as I said before, all of your decisions need to be data driven. So it is important to really know what your staff retention is like. Here's your basic retention formula at how you look at retention. It's your number of employees who stayed during the period over the number of employees that started times 100. So that's how you get your basic retention formula. So for example here, say you had 100 employees on January 1st, and on December 31st, 80 of those original employees are still employed. You don't count your new hires in that retention, only the ones who stayed. You do the 80 over 100, over 100 times 100, and you get your 80% retention rate. It is important when you're looking at this, you're tracking your retention rates by role. So you're looking at providers versus LPNs, MAs, front desk, behavioral health staff. The overall might be a little skewed, because you'll find certain levels you have really good retention, but others not as good. And it's important to really pinpoint where the problems are. We have multiple locations, so we also track it by location. Are we retaining everybody at our West Ward site? Are we at a 90 or 95% retention? But when we put somebody at our Lafayette Street location, are we losing them in the first 60 or 90 days? So it's really important to track that, if you have different locations, to see where the problem is on retention. And then tenure by bands. So you need to look at anyone who's leaving before the 90-day rate, which we would rate as an onboard failure, onboard and training failure, we usually rate it as. Somebody that stays 3 to 12 months, which is your early attrition, and then your 1+ years, that's your true retention. And that's what you're trying to get to. Our providers are contracted 2 years, and we really track how many of them are fulfilling those 2-year contracts and how many of them are renewing those contracts. Here's kind of how your 90-day looks like. So you have to, this is really important for your onboarding, for your HR department, for your training, because most of the people are in training for at least those first 30 to 45 days. We have our employees still employed after 90 days over our employees hired times 100, and that will give you your rate on your 90-day retention. Provider retention, we need to track this separately, because it has a huge impact on our revenue and our continuity of care. When you lose a provider, when you're onboarding somebody new, even if you're onboarding somebody the day that person's leaving, you're going to have that lag. You have to contract, your new provider with Medicaid and with all of your insurance companies and get paid on them. And you're going to have that lag. So it's really important to track your provider retention separately. And then you really need to look at voluntary versus involuntary. Voluntary are your resignations, which is usually because of culture, competition, things like that. And then involuntary is usually a performance issue, or disciplinary issue, but it is important to look at the two different. So once you categorize it, once you look at that 90-day rate, once you look at that 1-year rate, how many of those were voluntary and how many of them were involuntary? And then what does good look like on a retention? I think this is going to be a little different for everyone. I think you have to look where you are now and what your goals are. But for us, it looks like overall, we'd like our retention to be at 80 to 90%. Our frontline roles are usually a little bit lower. We see those around 70%. Our goal would be to get them up to 80, 85%. And our providers should be above 90%. And I believe we're at 95% right now on our retention for providers on a year. And why it matters. High retention reduces costs associated with turnover, improves patient outcomes, and strengthens your team stability. And then here is just a summary of our insight. So what matters most? Workforce well-being is essential to operational success. Retention requires flexibility, support systems, and a strong leadership. Structured incentives and benefits improve engagement. Supporting staff strengthens your patient care and your community impact. And investing in staff well-being leads to better outcomes for patients. A strong workforce is really your foundation to a sustainable care delivery system. A strong workforce really is your foundation. It matters to everyone. It matters to your health center. It matters to your patients, your outcomes, your clinical quality, as well as your revenue streams, all depend on your workforce. Thank you, everyone.
Thank you very much. I really appreciate that presentation, Nicole. Really, you highlight the importance of intentional data to be able to support efforts, and you brought that out in the work that you're doing. So appreciate you highlighting that for us. Oh, you got a number of questions that came in, so we'll walk some of those. If you have questions, you can continue to post those in the chat. Again, we'll get to those as time allows, or you can raise your Zoom hand, I believe, and be recognized for ask a question as well. All right, first question we got: how much charting time do your providers receive, and do they have any additional administrative time?
So they receive an hour of charting twice a week, directly after lunch. So all of our blocks for the entire month, every Wednesday, we have a 45-minute block in the morning where all of our providers meet with each other and our medical director every Wednesday morning. And then twice a week, they have an hour block for their charting. And every day, obviously, they have their hour lunch block. And then once a month, we have an hour and a half blocked after lunch on a Wednesday, where we do meetings with them, where we do their trainings, and then we'll always give them back that time if we don't use the entire time. But there's no other administrative time built into their schedules.
Thank you. How does your health center manage federal holidays across both 4-day and 5-day work schedules, particularly given that staff on 4-day schedules may receive a 4-day weekend, while those on 5-day schedules may receive a 3-day weekend?
So basically, you get your paid holidays. So if you were scheduled to work that day, you get your paid holiday like you normally would. And then for the people that weren't scheduled to work, they get their paid holiday, but then they also get a comp day. So basically, Memorial Day is coming up on a Monday. So everybody, that is scheduled to work on Monday gets the day off and will be paid the holiday. The people that were not scheduled to work that day, they get paid the holiday, and then they get a comp day. And the comp day is added to their bank to use with their PTO and everything.
Thank you. How many patients per day do your providers see, and what's your MA to provider ratio?
So it varies for our 4-day, 5-day employees. Our 4-day employees are typically, the goal is for them to see a minimum of 20 patients a day. It varies by specialty. Our pediatricians can be up at 25, 26 in a 10-hour day. They see a lot of patients, are busy, where most of our others hover right at that 20 patient mark. We've gotten really good at managing our no-shows to get them to that 20 patient mark so that they're getting their incentive bonuses there. And then our goal on the 8-hour employee days is the 16 patients, and the same thing there. Most of them are hovering right at that goal. Newer providers, during their onboarding, we have a ramp up period where, we schedule less. We start them at 1 patient an hour, then we schedule them at 2 patients an hour, and, we increase it from there to get them comfortable and make sure that they can chart and get their charts closed and don't feel overwhelmed.
Thank you. What's the impact on productivity? Of course, that's a question relative to administrative time that providers have.
Majority of them are not, they're still getting their incentive bonuses, even with those with those hours built in. Actually, we find giving them that hour of charting time, a lot of them are doing some telehealth calls during that time, and seeing some patients, but they're still hitting their goals even with those hour charting times built in. Making an employee see patients, the 10-hour day is a long day. It's a really long day. Getting in at 7:45 and leaving, like by the time you get out the door, 6:15, 6:30, that you have to give them those 2 days a week where they have that admin time to catch up on things. There's a lot of patients, but we really don't see it negatively impacting the productivity.
There was a question about your bonus structure, but I think you covered that very well during your presentation, and those slides will be shared along with the recording. Do financial incentives support staff as well, or just providers?
So we do have it for our support staff as well. Like specifically now, we need our medical assistants to do better with their depression screenings. And we're incentivizing them and running reports, and they get bonuses based on doing their incentive screenings properly. So we do make sure that we are doing the support staff as well.
Right. Has there been any insight into the expiration of rewards programs over the incentive bonus, allowing employees to earn rewards and turn those into marketplace items for pre-approved items they can self-select over time? Any research or comparison there?
We find at the end of the day, our staff wants money. We are in an environment where it's very competitive. We're in an urban area. We're competing against a lot of urban markets on hiring. And, maybe we have to keep our salaries right there and competitive with everyone. But at the end of the day, the incentive of bonuses help us that, we know our staff at the end of the day, they want money. We also do a program to really try to encourage our medical assistants and medical receptionists not to call out. Basically, put your time in advance is our big thing. We can cover it if we have the notice, but you need to put it in the system in advance. So basically, we say anybody without call outs for the first 6 months of the year gets a $1,000 bonus, and anybody without call outs for the second half of the year gets a $1,000 bonus. A call out constitutes 72 hours notice. So if you don't put your time in 72 hours notice, only a few people end up getting it, but they really do try. We find it really at the beginning of the year, they try hard. Once they mess up, obviously it goes out the door, once they call out. But it does help us. It helps us a lot on coverage. Because again, if we don't have enough medical assistants, if we don't have enough people checking in patients, it slows down our providers' productivity and it makes a big difference. So we'll have this, like for the first 6 months of this year, we'll probably have 4 or 5 that'll get the bonus across all our locations.
Great, thank you. One of our entities is a public entity, health center, and they can't issue bonuses. So they're wondering, are there other incentives that are productive besides bonuses?
Time off, PTO, comp days, I think are always huge for people. And employee recognition is important too. Recognizing, the good that they're doing and things like that. But, I think the biggest things are obviously the money always does it, but we've done other things as well. We've done rewards, we do contests and things like that, who has the best of this quality indicator in an 8-month period, and we'll have a prize instead. And they get competitive. If we can get we've gotten the MCOs to donate iPads to some of our competitions, and we send out reminders and really make a competition amongst the staff, because it also builds the bond between them. They're teasing each other then, and it makes it a more fun environment for them on top of it.
Thank you. Do you allow staff to sell back or their PTO, or do you require that they take some and or retain some balance?
We don't require them. They can, so again, you have to remember, like, especially like a lot of our heavy call out staff, some of our tiers, they don't have a lot at the end of the year. It's really our providers and your managers and your C-suite that are the ones that have it at the end of the year, that manage it well. So we give them the option. Their sick time is going to carry over. And, that's what you want. If somebody gets sick, has to take extended leave, they'll have their sick time, but we don't force them to keep their PTO. They can use it. They can get it paid out.
Thank you. What's your no-show policy?
So our no-show policy, we're very lenient on our no-show policy. We have a very late population. People don't, and I say very late, we have a very late and early population. They come whenever they want. Appointment times don't really mean anything to them. So our front desk staff is great at managing. They know our patients really well. And if we ask them to call, they don't really call, but we're good at filling them in. So if somebody's early for their appointment, our front desk staff is very well trained at monitoring the openings in the morning, and how fast patients are getting checked out to get them in if they're coming in early, and then we really try to fit them in. With our no-shows, we do double book a few slots, but we're very strict with what slots we double book. We double book our 9 a.m. slot because we don't want them to come in the morning and that slot be booked. We double book our 11 a.m. slot, and we book the slot directly after lunch or directly after their charting time. Again, it gives them the time in the day to catch up if both of those patients do show up. And we allow our providers to handle walk-ins. We always say our medical receptionists are not qualified to decide if that patient needs to be seen or not. They need to talk to that provider, or at least an LPN level, to make that decision if that provider should see that patient. And just the type of people we hire for our nurse practitioners and our doctors, they usually see their patients. They want to get their patient seen, especially if it's somebody that's non-compliant and doesn't come in.
Well, that'll have to be the last question for the time that we have. But I want to certainly thank you for the presentation and sharing your experience and insights with us, and for answering those questions. In terms of next steps, everyone, you'll have the opportunity to complete an evaluation. We ask you to please complete that evaluation. I think it is popping up as we speak. So we certainly do look forward to your feedback and your insights there. So please take a moment and complete that evaluation. I also want to note for you that the couple of folks asked about the recording and the slides. Those recording and slides will be sent to you via link. So you should get those when they become available. So be on the lookout for that for all who registered for the webinar. And we certainly want to express our appreciation and thanks to our speakers for both the sessions in this webinar series, Jaquetta Gatling last week and Nicole Fields today. Appreciate both of their presentations. Also want to express our thanks to our partners at ACU. Always a pleasure to collaborate with them. Want to thank our supporters at HRSA, the Bureau of Primary Health Care, for providing their support by way of funding to help us to bring these sessions to you. Of course, take note of the disclaimer that's in the slide there as it relates to HRSA and the Bureau of Primary Healthcare. And lastly, just want to say thank you to all of you. Really appreciate you taking the time out to join us. Again, we want to hear from you, so please take a moment to complete the evaluation so we can continue to strengthen the training that we provide for you, as well as to be able to ensure that we're meeting your needs. Thanks so much, everyone, and we'll look forward to seeing you at a training in the near future.